Good morning and Happy New Year, everyone. I'm Julianne, one of MHC's Public Health Committee Directors. Thank you all for joining us for our first health education webinar of the year, which is a collaborative partnership between MHC and South of Market Community Action Network, also known as SOMCAN. We have a lot in store for you today, so we'll just go over the agenda. We'll have an introduction from UCSF and San Francisco General ED physicians who are here, who kindly reached out to MHC to aid in supporting and educating your community during this time. We'll then have a COVID-19 vaccine update by Carissa, one of our public health directors. And then we'll have a presentation from public health on safe exercise during the COVID-19 pandemic. After that, we'll have a behavioral health presentation on coping mechanisms in Filipino culture. Following these presentations, we'll start a new stream and we'll have pre-recorded Tagalog presentations available to those who speak Tagalog. And if you would like to watch these presentations in Tagalog right now, feel free to leave a comment or send a message to our Facebook Messenger so we can get you a link to watch in Tagalog right now. So just some quick tutorials before we start. If you're on a laptop or desktop and you want to ask any questions, just type your question here and hit enter and return on your keyboard. If you're on a smartphone, you also would type your question in the comment area and tap that blue button to send your question. We'll also be using QR codes during this presentation to make accessibility to links easier. So if you see a code and want to fill out our survey, you will just point your camera at the QR code and click on the link that pops up above. So yeah, we ask you to participate in our polls today. We're going to have interactive questions throughout the stream. All you'll have to do is submit your answer in the comments. And each answer will equal 1 raffle entry, and we have some goods to give away today. So without further ado, I'm going to introduce the physicians from UCSF at SF General Emergency Medicine will be introducing themselves. The floor is yours.
Hi, everyone. I'm Dr. Santa Marina. I'm one of the emergency medicine doctors. We're from UCSF and San Francisco General. I'll have my colleagues introduce themselves afterwards. Just wanted to say that we are here because we want to find ways to support you all in making the best decisions for you, your loved ones, and your community, especially during this pandemic. We will be collaborating with local Filipino groups for another virtual event to answer COVID vaccine questions in the near future, and we will let you know details when we have them. Thank you for having us. And just to say this in Tagalog, magandang umaga po sa inyong lahat. Gusto lang po namin magpakilala. Kami po yung mga doktor galing sa Emergency Department ng UCSF at San Francisco General Hospital. Narito po kami ngayon dahil nais naming makahanap ng mga paraan upang masuportahan kayong lahat sa paggawa ng pinakamahusay na desisyon para sa inyo, sa inyong mga minamahal at sa inyong pamayanan, lalo na habang tayo ay nasa gitna ng isang pandemya. Maikipagtulungan kami kasama ng mga iba-ibang grupo ng mga Pilipino dito sa San Francisco at Bay Area para maagawa ng isa pang virtual na kaganapan para masagot ang inyong mga tanong tungkol sa COVID vaccine. Ibibigay namin sa inyo ang mga detalye kapag naasikaso na. Salamat po sa pagbigay sa amin ng inyong oras.
Thanks, JL. I'm Dr. Mickey Gonzalez, and I'm happy to be here today. Also excited to learn about what you guys, how we can help you. Going further, I would love to be more involved in terms of like helping out with the clinic and whatever the community needs. I'm from San Francisco, and I feel very connected to this community, and I was excited to hear about being able to be a part of this.
And my name is Dr. Amelia Breyer. I just wanted to express gratitude to her for being here today and show my support however I can for this community. So thank you.
Thank you so much, Dr. Breyer, Dr. Gonzalez, and Dr. Santamarina. We look forward to working with you in the future. So if you have any questions for these physicians or about COVID-19, we want to hear from you. We have a survey available that you all can fill out to just hear your needs and what type of education you want to receive about the vaccine or COVID, etc. And without further ado, we're going to move on to the COVID-19 vaccines update by my co-public health director, Carissa Feliciano.
Hi, everyone. Good morning. Thank you, Julianne, for the introduction, and thank you to our doctors from UCSF and San Francisco General Hospital for introducing themselves. Today, I will be talking and giving an update about the state of the COVID-19 pandemic. I will be focusing on the COVID-19 vaccine, a little brief review of the testing sites that are available in San Francisco, and I'll be talking a little bit about the updated guidelines in regards to the new Stay Safer at Home order. So there has been a lot of talk about the COVID-19 vaccine recently. Right now, there are 2 COVID-19 vaccines that are authorized for emergency use. These are the Pfizer COVID-19 vaccine and the Moderna COVID-19 vaccine. Both of these vaccines are mRNA vaccines. They both require 2 shots. Pfizer's vaccine is 21 days apart, and Moderna's vaccine is 28 days apart. Both of these vaccines have shown over 94% efficiency at preventing COVID-19. And this is 7 days after the second dose. So your immunity towards the coronavirus doesn't kick in until you get that second shot. So how does this vaccine work? I know a lot of you may not be familiar with the term mRNA. What is it? And what exactly is the spike protein that this vaccine is encoding? So in order to develop this vaccine, scientists first discovered the genetic sequence of the spike protein. The spike protein depicted here in red is the protein on the coronavirus that helps it bind to and enter our cells. And they use this genetic sequence to develop or to create spike protein mRNA. And mRNA depicted here in yellow are basically genetic instructions which tell our cells how to make the spike protein. This mRNA is packaged in what they call a lipid nanoparticle. Basically, this is just a coating that helps the mRNA enter our cells. And this mRNA is what is in the vaccine and is what is injected into our arm. So once the mRNA is in our system, this mRNA will enter our cells. The cells will use this mRNA or these genetic instructions to create the spike protein. Once the spike protein is produced inside our cells display it on the outside of our cells. Once it's on the outside, our immune system realizes that the spike protein is not a protein that's normally in our body. It's a foreign protein. And this alerts our immune system to start developing an attack against this spike protein. Just as a side note, a lot of people are worried about the effects of the mRNA. And so once the mRNA is used to make the spike protein, it's actually broken down by our cells and discarded. So this mRNA does not affect your DNA whatsoever. It's just used to make the spike protein, and then it's degraded. So once the spike protein is displayed on the outside of your cells, our immune system starts to develop an attack against it. What this means is that we are building up our antibodies and our T cells or our white blood cells. Our body produces these antibodies and activates our T cells or white blood cells in response to this spike protein. So in the case that the real coronavirus enters your body will be able to recognize the virus quickly and quickly start to build an attack against the virus. How this works is the antibodies that your body produces will bind to this spike protein. Here it's depicted in green. And so when the antibodies are binding to the spike protein, it prevents the spike protein from helping the coronavirus attach to our cells and enter our cells. So in essence, the antibody will kind of disable the coronavirus. The T cells that your body had activated will be able to recognize and kill any infected cells, any cells that already had the coronavirus enter them and is starting to reproduce the coronavirus. So our T cells or white blood cells will be able to kill those infected cells. Does anybody have any questions so far? I'm just going to go over a brief overview. So basically, the coronavirus vaccine, the COVID-19 vaccine, the Pfizer and Moderna vaccines are mRNA vaccines. Basically, they are these genetic instructions which tell our cells how to make this spike protein. Once the mRNA enters our cells, our cells use these instructions to produce the spike protein that is displayed on the outside of our cells. This alerts our immune system to start producing antibodies and activating our white blood cells to attack the spike protein. So in the case that the real coronavirus enters your body, you will be ready to fight it. Does anybody have any questions so far about how mRNA vaccines work? If you have any questions later on, you can go ahead and comment it in the comment section, and we'll be sure to respond. And we can also try to address your questions at the end of the live stream. So what are the side effects of this vaccine? The most common side effects are sore arm, so just pain, any pain at the site of where you got the shot. And there's some people also experience fever, chills, tiredness, and headache. And most of these symptoms are experienced after you receive your second dose. Most of the side effects experienced were mild to moderate. And these side effects may feel like the flu and even affect your ability to do daily activities, but they should go away in a few days. If you experience any flu-like symptoms, this is not the flu. It's just your body preparing and developing all of these antibodies and activating your white blood cells. It's just your immune system kicking into gear, and that's why you may experience these symptoms. So I know a lot of people have a lot of questions about the COVID-19 vaccine, so we're just going to go over some common questions. So why should I get the vaccine? It is really important for everyone to get, or most people to get the COVID-19 vaccine. It might prevent you from getting COVID in the future. And in the case that you do get COVID, the vaccine will prevent you from becoming seriously ill. Since your body will already be prepared to fight the virus, your symptoms will not be as severe if you end up getting COVID-19. So can I get COVID-19 from the vaccine? And the answer is no. There is no live virus in the vaccine. As we saw today, it's just the mRNA and it's not the actual virus. So you will not get COVID-19 from this vaccine. And lastly, can I stop wearing a mask if I get the vaccine? And the answer is not yet. It'll take a while for everyone to get the COVID-19 vaccine. So until the public health officials tell us, we will want to continue to social distance, wear a mask or face covering, and wash your hands frequently. And lastly, when can I get the COVID-19 vaccine? I'm sure a lot of us are eager to get the vaccines. And so the answer is the vaccine will be given in phases. We are currently in phase 1A. So the vaccine is currently being given to frontline healthcare workers and long-term care facility residents. After that, the next phase is phase 1B, and there's actually 2 tiers. So in tier 1, we have people 75 years and older, and then also certain essential workers that are highlighted here in yellow. Tier 2 of phase B will be those 65 years and older and other essential workers, and also incarcerated and homeless individuals. They expect phase B to start sometime in January. And phase 1C is people who are 50 to 64 years old and people 16 to 49 years old with underlying medical conditions, and then some other essential workers. Right now, it's unclear when the vaccine will be distributed to the general public or those outside of these phases. Right now, there is a limited quantity of the vaccine, so they're working on prioritizing who should get the vaccine first. Okay. And does anyone have any questions about the COVID-19 vaccine distribution? Okay. In terms of COVID-19 testing, you should get tested if you have symptoms or in close contact with someone who is COVID-19 positive or are an essential worker. If you have insurance, please be sure to contact your doctor or health provider first. There are free testing sites, but the testing sites have a limited number of tests and are currently very busy. So if you do have health insurance, it's best to go through your healthcare provider first. If you do not have health insurance, there are a lot of free testing sites available in San Francisco. So these are some of the main ones. The main ones you may have heard of are City Test SF or Color. And these test sites are available at Embarcadero and Alemany Farmers Market. Previously, there was a test site at SOMA, but that site has since been closed and it was replaced with the Alemany Farmers Market site. There's also some tests available at City College through Optum. And there's also a company called Curative that hosts many test sites throughout the Bay Area. And for all of these, you will want to schedule the appointment ahead of time online. For Color, you can schedule a week in advance. And for Curative, you can schedule 3 days in advance. And we will provide these links here. So if you go ahead and take a picture or scan this barcode, it'll bring you to a site where we have all of the links to the COVID-19 testing sites and also some COVID-19 resources. And if you don't have an iPhone, this is the link right here that the barcode links you to. It's a link tree, so there's just a bunch of links on there that are really easy to just click on. And we can also post this link in the description of our Facebook post. Okay. Lastly, I'm going to go over some COVID-19 guidelines. Recently in December, the state and the region implemented the Stay Safer at Home order. So in this order, you should only gather with members of your household. You can actually meet with one other person who doesn't live with you, but this should be outside. and you should both wear mask coverings and still stay 6 feet apart. If you go outside, be sure to always stay 6 feet away from others and wear a face covering. And in this order, you can still go outside to exercise with members of your household. I recommend going on hikes, going on walks, or biking. And if you do go out to exercise, be sure to wear a mask if you are coming in close contact with other people. And lastly, in terms of quarantine guidelines, for those coming back to San Francisco from outside the Bay Area, you must quarantine for 10 days. This is just to prevent the spread of COVID-19. We don't want to bring in any virus from outside the Bay Area into the Bay Area. Okay. And so to wrap up this presentation, we're just going to have a question, and any entry, if you comment your answer below, this will be an entry into our raffle where we'll have some prizes that were provided by MHC and SOMCAN. So the question is, what is the Pfizer and Moderna COVID-19 vaccines, or what's in them? Is it live coronavirus? B, dead coronavirus? C, spike protein mRNA? Or D, spike protein DNA? And I'll give you time to go ahead and comment your answers down below in the comment section. Okay, I see that people are commenting. I'll give you guys one more minute before we reveal the answer. Okay, and so what is in the Pfizer and Moderna COVID-19 vaccines? As we were talking about today, the answer is C, spike protein mRNA. So if you got the answer right, go ahead and pat yourselves on the back. But all answers will still be submitted into the raffle. So thank you to those who participated. And lastly, if you have any questions about this presentation, go ahead and comment down below. If we don't get to your answer right now, we will definitely reply to your comment and maybe address it at the end of our presentation. All right, thank you everyone for your time today. And I'll go ahead and introduce the next presentation, which will be given by our PH committee.